All right, so today we're going to be looking at the SCIM, or Spinal Cord Independence Measure. So this is an assessment that you can use to kind of just see the functional capacity and independence of your patients. And we can use this in the clinic. And this version today is actually the third version, so they've been kind of adding on, just kind of making it more functional and adding in more tasks that can kind of fully get a full, I guess, overview of your patient.
All right, so just to reiterate, the SCIM is a disability scale developed to specifically address the ability of spinal cord injury patients to perform basic activities of daily living independently. So we really just want to see what they're able to do by themselves. There have been several versions of the SCIM. Currently there's 3 out, and this one assesses 3 different areas: self-care, respiration and sphincter management, and mobility. So this assessment should usually take around 30 to 45 minutes. And as a clinician, you want to try and observe as much as you can, watching your patient, seeing how they perform the tasks and things of that nature. Obviously, you may have to assist, and you'll mark that kind of down in your assessment. All right, so let's talk about scoring. Scores are derived by adding up the items, producing a total score of anywhere from 0 to 100. So there's these kind of subscale scores, which are the 3 main categories, like I mentioned before. So self-care, respiration, sphincter management, and mobility each have a subscale score, and you add that up to have a total score of anywhere from 0 to 100. And so pretty much SCIM kind of interprets these results by saying that higher scores reflect higher levels of independence. So without further ado, let's go ahead and watch an SCIM and see how it's performed.
Continuing with the SCIM, they kind of break it down into 3 categories. So first is self-care. So we're going to be working on feeding, hygiene, things like that, dressing and whatnot. So right now I'm with Celia, our patient, our spinal cord patient today, and we're just going to see, like, is she able to feed herself? Is she able to pick up a cup and things of that nature? So, all right, Celia, show me what you can do.
Okay.
So,
my spoon,
spoon,
my bowl of macaroni and cheese.
mac and cheese here.
Oh,
So, yeah. So she is able to, as you've seen, like, by herself, no assistance. Eat, feed herself, and so by that we would give her a rating of 5. So with no assistance. And now the next thing is she able to hold a cup, kind of bring it up to her mouth, and once again, as you can see, she's able to do that with no assistance.
And next in self-care is bathing, and so we would observe Celia and see, what she's able to do in the tub, whether she's able to reach, all upper and lower extremities, or whether she needs assistance. Celia was able to do most parts of bathing, but was unable to reach some of the distal extremities. So partial assistance, grading her at a 3.
All right, and we're back for self-care. So now on this part of it, we're seeing dressing. Like, is she able to prepare her clothes, dress, like able to put on a jacket, sweatshirt, sweatpants, things of that nature by herself? And then can she undress it as well? So Celia, can you try and put on this jacket for me? Maybe a little assistance there. All right, good. So she's able to put on the jacket with no problems. Can she, take the jacket off now as well? Yeah, so, for the most part, upper body, she's able to kind of dress, do things of that nature. Now let's see, is she able to use kind of her lower body and put on some sweatpants? Some big pants today.
I'm gonna go for comfort.
So yeah, obviously may need a little assistance, so I'm gonna help.
Can you help me?
Kind of put
It's really hard.
sweatpants on
Hold my leg up like that.
her foot.
This one part I always get stuck.
Yeah.
It'd be great to have an assisted device for this. Oh, it's like a nice cinch at the ankle. Okay.
Oh yeah. So as you can see, I think with just lower body, you know, sweatpants, she needs a little bit of assistance getting those things on. And so for that, we would grade that as a 3 as well, needing a little bit of assistance for getting pants on.
Okay.
All right, so the next part of self-care is kind of just hygiene in the sense of washing hands. Are you able to use a toothbrush and toothpaste? Kind of normal ADLs like that. So as you can see, Celia is kind of able to use her upper extremity to reach her face. And some Degree Men deodorant. She's able to use that as well without any assistance. Yeah, and she's able to wash her hands and face without any assistance. So with that, we would probably give her a 5 because she needs no assistance and no help with performing those activities.
Okay, so next part of the SCIM or next category is going to be kind of ventilation and sphincter management. So this first section, we're just going to ask, you know, Celia, and obviously kind of observe, like, is she able to breathe on her own? Is she able to, you know, not need a ventilator or kind of some sort of tube to help her out with that? So obviously, like, Celia, are you able to breathe on your own?
Mm-hmm. Yeah, I've been doing my belly exercises.
Mm-hmm.
Yeah, I don't cough or need assistance with any of those things. I'm good. No vents for me.
No vents for her. So that's good.
So we would grade that as a 10, breathes independently without any device. All right, so the next section is going to be bladder and bowel. So this is part of the sphincter management and respiration kind of category. So obviously, you know, in real life clinical setting, you would observe these tasks, but for this video, we're just going to just kind of assume or ask questions about it. But in a real life setting, you would try and observe as much as you can. And so if need be, we could observe Celia performing these tasks.
So this is still the category in the SCIM of kind of ventilation and sphincter management. So the next part is toileting. So I'm just going to kind of ask Celia, like, are you able to undress enough to use the restroom? Do you need help, assistance cleaning afterwards, or anything of that nature? So Celia, do you need help with that?
Yeah, I mean, I'm able to like undress and like transfer to get to the toilet, but like actually doing like the whole toileting process is a little tough for me. Okay. It's nice to have assistance, but so I would say I still kind of have a hard time with that.
And so we would observe Celia in this instance and see what she can do. Grade that as a 2, as needing assistance after undressing. All right, so next part of the SCIM, we're actually in a new category, so this is mobility. This part is kind of looking at mobility in bed. Is she able to turn? Is she able to kind of release pressure for pressure sores and things of that nature? So Celia, can you try and like turn on your side for me? Okay. So she is able to kind of turn on her side. Celia, can you sit up from that position, or do you need help with that? Okay. So as we just saw, Celia is able to kind of sit up in that position. Can you kind of push up with your arms, like, and get your body off the ground? Okay, good. So Celia, in this sense, was able to perform these tasks without any assistance. We would grade that as a 6, as being able to push up off of the bed. All right, so next part of the mobility kind of assessment portion of SCIM is a transfer from the bed to a wheelchair. So Celia, are you able to kind of transfer from your bed to the wheelchair?
Mm-hmm. Yes.
Okay. Would you like to show us that?
Made it.
Made it. So she may need a little bit of assistance with that,
Yeah.
but for the most part, she's able to do it. We would give her a rating of 1 as needs partial assistance or supervision. All right, so next part of the mobility assessment for SCIM is transfer from her wheelchair to the toilet or tub. So we're going to use this chair kind of as the toilet, and Celia's going to transfer from her wheelchair over. And so she's able to take off her armrest. She's able to kind of maneuver her footrest as well.
Locked my wheelchair.
And the wheelchair is now locked. All right, so she is able to do that, and with no assistance. So we give that a rating of 2 as independent with no assistance. All right, so next part of the mobility kind of assessment for SCIM is just kind of mobility indoors. And so we're seeing how Celia gets around indoors. And Celia, whenever you're ready, if you want to just kind of travel down the hall for us. We're also going to combine the other portion of the mobility assessment, and that's, is she able to kind of go from 10 to 100 meters, kind of down this hall will kind of represent that. All right, so as we just saw, Celia was able to kind of make her way indoors using a wheelchair. And so we would grade that as using a wheelchair. And she was able to get about 100 meters as well. So we'd also grade that she's able to do that with her wheelchair. So both ratings receive a 2 as being able to move independently in a wheelchair. All right, so we're now outside, and we're going to kind of just assess for the next part of the mobility assessment, just mobility outdoors. So Celia's going to travel in her wheelchair outside, and we're just going to assess and see how she does. So, yep, Celia, for the most part, is able to kind of maneuver going in her wheelchair down. So here she is going down a ramp. And awesome. So we would grade that as Celia was able to use her wheelchair moving outside. So we would rate that as a 2, meaning moves independently in manual wheelchair. All right, so another part of the mobility assessment for SCIM is stair management. And so obviously I think Celia is unable to kind of get up out of her wheelchair and use the stairs. So we would grade that as a 0, being unable to. So the last part of the SCIM assessment is kind of seeing if Celia is able to get in and out of a car. So we're going to ask her to do that for us and see how she does and if she needs any assistance or anything like that. So obviously she's kind of able to get herself in, a little difficult. With adaptive devices and assistance it may be easier, but she ultimately was able to kind of get herself in, and so we would grade that for that measure. So for this measure we would grade that as a 1, needing partial assistance with transferring from a wheelchair to a car. Alright, so we just completed our first round of the SCIM measurement. And so as you can see, our self-care subscale score was 16 out of 20, A respiration and sphincter management was a 12 out of 40, and a mobility subscale score was 16 out of 40, with a total score overall for SCIM as 44 out of 100. And so as you can see, there's other spots for round 2, round 3, and also round 4. So you can kind of measure throughout their treatment, seeing how they progress through this mobility and functional assessment score.